Hello, my name is Natalie Leblanc. I'm an assistant professor here at the School of Nursing, University of Rochester, and I'm also the Dean's Endowed Fellow for Health Disparities. So my current research focus is in couple-centered HIV prevention and treatment, or couple-centered combination HIV prevention. I also look at, more importantly for me, is provider practice, health provider practice with regards to sexual health promotion, with regards to HIV prevention, with regards to working with couples to get to a place where there is sexual safety, and however that's defined, and ensuring that people are being treated for HIV and other STIs and STDs in ways that promote sexuality and sexual health. You know, we have this treatment available, we have the medication available, but if people cannot access the treatment, then, you know, what are we doing? And so when we think about the challenges that are still persistent when it comes to HIV, we know that it's the engagement of people who are living with HIV into care is where we see the biggest drop-off. This is what we're challenged with, is getting folks to get tested, to adhere to treatment, and to engage in care. When we talk about providers as well, we see that at times that is the provider characteristics, the training that providers are coming with in their care can have an impact and influence on patients. We also understand it's not only the provider, it's the environment that providers have to operate in. And so some of the challenges that we do see in HIV prevention, some of it is ecological, not only the work environment, but also the social environment. HIV still remains to be a very stigmatizing disease, even though it is treatable. Because we've made such advances in HIV prevention and treatment, I'm hoping that my research that's focused on couples will aid in destigmatizing HIV infection, and we're able to talk more freely about sexual health and wellness being related to our overall health. We're not there yet. And we know that people who feel supported with their diagnoses are able to adhere to their medications, are able to remain engaged in care. And so what couple-centered approaches allows for is this person who's, an intimate part of this person's life to be involved in the treatment and care of someone living with HIV. And so what makes this exciting is that we're creating the research and creating the science to help support the action that's needed to, whether it's through policy, whether it's through healthcare practice, whether it's through communication.